Okay, so I'll be pretty quick. So the only thing more nerve-wracking than following Dr. Eaton is coming before Dr. Swinberg. But I did it to myself. So this is gonna be a little bit more of kind of a storytelling type of lecture. So, and hopefully can give some background on why we're interested in Louisville and environmental health. So this is a real patient that I saw in clinic that I want to present. A 67-year-old male came in with epigastric pain, weight loss, and he had a palpable liver mass. And so this individual worked in polyvinyl chloride production for B.F. Goodrich here in Louisville as a poly scrubber from approximately 1964 to 1969. And he cleaned about 5 reactor vessels per day. And so what they did in their process is they put vinyl chloride gas into a tank. It polymerized into PVC plastic, and they tapped that, drained that out of the bottom. But over time, the tank would fill up with hard plastic, and they couldn't use it anymore because it was full. And so they sent these guys in with basically ice chippers, like you scrape ice from your car. And while they were in there, there was no ventilation. And what happened is that PVC is non-toxic. We use it every day, it's in this computer, but the vinyl chloride monomeric gas is, and so the gas would be trapped in between the layers of the plastic, just like layers on an onion, and they would breathe that in. So another recurring theme in hepatotoxicity for us anyway is that this individual had normal liver biochemistries. So his ALT was 17, AST was 16, and his total bilirubin was normal. And so that's amazing to me because he has a huge burden of disease on his CAT scan. So he had a 20 centimeter hypervascular liver mass illustrated here, and biopsies reveal hemangiosarcoma. So this is a malignant tumor of blood vessels, believed probably to be sinusoidal endothelial cells. And so you can kind of see this tumor is trying to grow little blood vessels. Here's one in cross-section here, and there's kind of another one in cross-section here. And it was c-KIT positive. For pathologists in the audience, they could see how it's stained. So anyway, I tried to treat this guy and unfortunately failed miserable, and this is consistent with our experience. So here's his tumor when it started. He underwent transarterial chemoembolization, or TACE. I treated him with systemic chemotherapy, sorafenib, and you could see how much I helped him. Now the tumor is over here too. And so the only liver that he has left is this little sliver here. And so he died 6 months later, and when he died, his liver biochemistries were totally normal, which is unbelievable because this is all the liver he has left. But we've seen this now 26 times, and so you got to start believing it at some point. All right, so Louisville Rubbertown. So this is our chemical manufacturing complex. It started in 1918 with a Standard Oil refinery, and in the 1940s, the Office of War Production bought chemical plants in Louisville and built more chemical plants to make rubber. So the shipping lanes were cut off. We couldn't get natural rubber. We needed tires for military vehicles, and so it was decided to make it here in Louisville because centrally located, access to the Ohio River for shipping, and so they built Rubbertown to make tires for military vehicles. And associated with that in the 1940s, the landfill associated with Rubbertown started operation and operated till 1975. That was called the Lee's Lane landfill, and like the Valley of the Drums, it was one of the very first Superfund sites and was listed in 1983. Here's a picture of the landfill. So a little bit more environmental history. In 2002, EPA Region 4, Louisville had the highest air toxics in that region. But as a success story, I hate to point out all the bad things about this town. I love it, but one of the great things is as a success story, based on this, we implemented the Strategic Error Reduction Program and cut butadiene emissions by 75%. So we've gone from one of the worst in the nation to one of the best. We currently have 11 chemical companies in Rubbertown, 1,500 employees, and importantly, there's 30,000 residents within 1 mile, largely minority and poor, and this always raises questions of environmental justice. All right, so what about the B.F. Goodrich plant? Began in 1942. In 1974, 4 cases of hepatic hemangiosarcoma were reported in plant workers in JAMA by the plant doctor who was also a surgeon. Dr. Tamburo, who the symposium's named after, was hired to conduct hemangiosarcoma screening and surveillance project. This sentinel event in occupational health led in 1975 to the vinyl chloride standard, which reduced exposures to vinyl to approximately 1 part per million time-weighted average. And importantly, it mandated surveillance with liver enzymes in exposed workers, which personally don't think is going to be very effective, because all of our guys had normal liver enzymes, just like the case that I presented, and liver enzymes do not work for early detection. So our most recent case of hemangiosarcoma came in 2011, and importantly, we're seeing these cases 30 to 40 years after their last exposure. So there still are at-risk workers here. Even though this is a genotoxic carcinogen, there is an incredibly prolonged latency period, which I don't understand, but this is another thing we see repeatedly. So what about our occupational health and surveillance program established by Dr. Tamburo? So it was started in '74. It was a collaboration between industry, NCI, U of L, and it's ongoing even today. Dr. McLean and I direct the surveillance program, and we manage the biorepository. Here's an example of some chemicals that have chemical companies that have participated over time. We monitor multiple exposure. Here's an example of some of the chemicals that workers are exposed to, and we have longitudinal data, which allows us to assess changes over time. So we have several databases associated with the biorepository, and where I'm going with this is, we hope we can utilize this resource to collaborate with anybody that's interested in the room. But we have an epidemiological database with nearly 6,000 work history with a semi-quantitative measurement of chemical exposure and mortality statistics. There's a medical surveillance component, and then there's a large number of biological specimens that are available as workers gave blood on an annual basis. So what is available in our medical surveillance files? So these are all managed by Lark, by the way, so she's very, can do a lot of things, multi-talented, but she manages these. These are examples of things that are available: physical exams, PFTs, EKGs, audiometry, some liver biopsies, heart catheterizations, and imaging. Now, the nice thing about being able to have the longitudinal data, we can follow things over time, and so chemical workers aren't any different than anybody else. They're actually getting more and more obese as the years go on. And so 1970s, less than 10% prevalence of obesity in Rubbertown workers, and in the 2000s it was up to nearly 40%. And so, one of the recurring themes that I've heard in this symposium is diet interactions with chemicals. And so because of this phenomenon, we're able to study that in humans because we've got weight going up and chemical exposure combined. So examples of some of the types of resources we have in our specimen bank: we've got, this has been expanded over time. We have subjects with alcoholic liver disease. I've recently shipped some to Wen Shi, and he's hopefully going to get a paper out of that collaboration. We have hepatocellular carcinomas, hemangiosarcomas, arsenic exposures, VOC exposures through a collaboration with Dr. Bhatnagar and the Louisville Healthy Heart Study, NAFLD samples. Some of them, again, are in provided in collaboration through Aruni. Large number of occupational liver disease, listed 7332. I believe these are unique subjects, and we have multiple time points on some of these. So huge resource left by Dr. Tamburo. All right, so what about vinyl chloride? So we've now had 26 cases out of this one plant. So the worldwide incidence of this tumor is about 30 cases per year. So we've now had 30 in Louisville from one chemical plant, BF Goodrich, and so they also had operations in Calvert City, Kentucky, and Avon Lake in Ohio, and it's my understanding that there were several more cases through these sites. We've seen 4 hepatocellular carcinomas. We think that I think there's many, many more. Because these are a little bit harder to track. When you have a hemangiosarcoma, it gets people's attention. Hepatocellular carcinoma can go through medical treatment system and go unnoticed. I actually saw one in the emergency room about a year ago. A former plant worker had hepatitis C, did really truly have exposures, but presented with GI bleeding and hepatocellular carcinoma. Now, whether there was any synergistic effect with the exposures and the virus, I don't know. It has been suggested for hepatitis B to be the case. If you lump all these 30 cases together and just call them liver cancer, the SMR versus US is 534 for liver cancer. If you calculate the SMR for hemangiosarcoma, it approaches infinity. So mean age was 58, the mean BMI was 25. Most subjects in Louisville did not drink or smoke. There was this huge latency period, 30 years, and that's why even after vinyl chloride standard was implemented in 1975, these cases are still presenting 30 or more years after their last exposure. It requires the development of the tumor requires an extremely high exposure for an extremely long time, and so we estimate that the mean vinyl exposure was about 17,000 ppm years for these subjects. And again, the workers today should be operating at about 1 ppm year. So a ppm year is kind of like a pack year that we assess as physicians. So hemangiosarcoma was a rapidly fatal tumor, and the mean survival was 1.25 years. There was one subject that had a prolonged survival with liver resection. So it's been a little while since I've presented some of these data. Last time we presented them was at SOT, and European vinyl company approached us and said, well, this is great angiosarcoma data, but we don't care. And I said, well, what do you mean? Why do you not care? And he said, well, in Europe, we don't get angiosarcoma. All of our workers get hepatocellular carcinoma. They get cancer. And so this was a publication that I think illustrates potentially a very important diet pollutant interaction. And so our workers reported that they didn't drink, and I've got some data I'm not going to show that makes me tend to believe them, but in the European cohort, that wasn't always the case. And so these are odds ratio for hepatocellular carcinoma with high vinyl exposures, high alcohol exposures, and then both. And so you see a synergy here for the development of hepatocellular carcinoma, 409 odds ratio, and also cirrhosis, 752. So, my guess is alcohol plus vinyl gives you bad steatohepatitis, and that predisposes you to hepatocellular carcinoma. And so I think our workers, and by the fact that they didn't drink, may have protected them from HCC. And certainly alcohol is going to impact the metabolism of vinyl through upregulation of CYP2E1. So there is a mechanism here, and I think it's going to be important potentially to study from an EHS standpoint the impact on ethanol and industrial chemicals due to alterations in metabolism and antioxidant defenses. So here's the mean liver enzymes on our 26 patients, all normal, presenting signs. So they had advanced disease, hepatomegaly, splenomegaly, edema, ascites. So they presented like our case presentation with advanced liver disease, but with normal biochemistries. And so the liver cancer screening and surveillance project was ultimately a failure, is that it did not enable early detection of hemangiosarcoma because the biomarkers were no good. and there's still cases presenting today, and better biomarkers are needed. So one thing we've been working on using our specimen bank is biomarker development. One potential biomarker that we chose to look at was hyaluronic acid, which is a matrix protein. We've heard a lot about the importance of the matrix here in this symposium. It's metabolized within sinusoidal endothelial cells, so the hypothesis was that hyaluronic acid would be high because it's not metabolized due to sinusoidal endothelial cell dysfunction because they're cancer. And there is a role for this molecule in cancer. And so we measured that in some of our workers. And this came initially with 2 workers we looked at the time of diagnosis had high hyaluronic acid levels, and that led to measurement of HA in more subjects. And so here you can see that those with hemangiosarcoma had an elevation in hyaluronic acid compared to those workers with low exposures, or those that did not have cancer, and workers with high exposures that did not have cancer. And we looked to see if there was an association between hyaluronic acid and cumulative vinyl chloride exposure, and there wasn't. So this does not appear to be a biomarker of exposure, but rather a potential biomarker for cancer. Here's a little bit more data with some additional controls put in. We tested some subjects that did not have hemangiosarcoma but would develop it later. So this was so we were able to go back with yearly blood samples and say, well, subject 26 with hemangiosarcoma, let's, test a biomarker at the time of diagnosis, and let's see if that biomarker was elevated a year or 2 before the diagnosis. And looks like it's starting to rise here. So it appears that this might be a promising biomarker. These studies are going to be limited by their design because nobody has this resource, so we can't validate these biomarkers. So we can discover, but we can't validate. It's the best we can do. But this was a proof of concept that we can use the specimen bank for biomarker development in general. And then we followed that up more recently with a plasma metabolomic analysis. And what we did was took modern-day controls that had no exposure and did metabolomic analysis on them along with vinyl chloride exposed workers without cancer from the 1970s and those with vinyl chloride exposure and cancer also from the 1970s. So the ends were 27, 17, and 16. These were very tightly matched for exposure, gender, demographic factors. We unfortunately didn't have a lot of controls samples in the biorepository from the 1970s that had low-level exposures that matched well, and so that's why we pulled some modern-day controls. So there's an inherent problem with this study design in that these controls haven't been frozen for 30 years, and these have. But this is the primary comparison is going to be between these 2 groups anyway. And so we found a few things, and Metabolon found a few things, and they found that there did appear to be a distinct metabolome in those workers that had hemangiosarcoma versus those that did not, and they gave up to 82% diagnostic accuracy. So some of the things that seemed to be important were, as predictive factors, were bile acids. And here's exposed minus cancer, exposed with cancer. I don't know if it's good or bad when you do a study and spend a lot of money and then you find things that you already knew. I guess it makes you feel better, but then it makes you, and trust the old data, but then it makes you feel like you wasted money. So Carlo Tamburo had a publication in 1970s or 1980s saying cholic acid conjugates are helpful in identification of vinyl chloride toxicity. So I guess we rediscovered what Carlo knew. We've heard a lot about coagulation system during this symposium, and we found that fibrinogen degradation products were elevated in those with cancer and those without. The modern-day controls, they seem to be up a little bit too. I don't know if this is a storage difference effect or what, but again, the primary analysis is these 2 here. Now this was already known too, but it wasn't known in humans. it was known in dogs. So dogs get hemangiosarcoma, and it's been reported in at least 2 papers that dogs with hemangiosarcoma have decreased fibrinogen and increased fibrin degradation products. And in fact, it was reported that 25% of dogs with hemangiosarcoma died of a bleeding event, which was felt to be related to defect in the coagulation system. So yet another thing from the past that we rediscovered. This was a little bit new, and I don't quite understand this, but essentially all the gamma-glutamyl amino acids were upregulated in subjects with cancer. I was wondering, if maybe this is some marker of, glutathione consumption or whatnot, but there were no difference in oxidative glutathione levels noted on the metabolomics. So, why this is, I don't know, but there was a recent paper that suggested glutamated amino acids could be used as biomarkers for different types of liver diseases. And in this paper, the authors took viral hepatitis, NASH, ASH, and measured these things, and you could find differences. So this may be an emerging biomarker for liver disease. And then the final thing I'll talk about is this was, I guess, new and a little bit surprising, was that the bradykinins were up in people with hemangiosarcoma. And I don't understand that, but there are some reports that some cancers do produce kinins, and these are autocrine growth factors. So the tumor may be feeding back to itself, trying to get it to grow. And it was kind of nice to find that. We have previously measured VEGF because we thought maybe the tumor, if it's a vascular tumor, maybe it was feeding itself or something was feeding it with VEGF to grow, and VEGF wasn't up. But maybe there was an autocrine loop, it was just a kinin. So conclusion, hemangiosarcoma was a sentinel occupational health event in Louisville. It's probably the most important occupational liver health event in history, I guess. There's a very long latency period. Cases still present today, and I do my best to take care of them, but it's a very deadly disease. Subjects have normal liver enzymes, and so my concern, and one thing I'm afraid of, is that the vinyl chloride standard, the monitoring that's required by that, may be ineffective to detect liver disease, whether it's hemangiosarcoma or TASH, which I think is a bigger problem. But I can say since implementation of 1975 at our plants, we've not had a case of hemangiosarcoma that developed in a worker that was hired after 1975. So it appears that it protects against hemangiosarcoma. We have no idea whether that low level is protective against TASH, particularly when the plant demographics suggest that the workers are getting more and more obese. And so I worry about that. We have the means to investigate it with the Specimen Bank, but we have not done so yet. We're working on biomarkers, and we have quite a few samples that we'd like to collaborate with people on. And I guess that's about it. Thank you.
So Matt, if okay with you, in the interest of time, what we could do is maybe defer questions for...
Great idea. Great idea.
That sounds good.
And I'm available all afternoon.
Okay, terrific. Thanks a lot.
For those standing in the back, we're having all this piped into CTR 124 if you want to sit down. You'll get to see and hear everything. And there's seats over here.
So there are some seats here. Welcome. Come to the front. It's fine. So it's an honor for me to introduce shortly James Swenberg, who's going to give the Bill Waddell Memorial Lecture.